In nursing school and on your NCLEX exam, you'll be faced with many different types of question formats. In this video, I will explain how to answer these questions correctly. There are 8 alternate format questions: fill in the blank, multiple response, prioritizing, figure or illustration, chart exhibit, graphic item options, audio and video, and testlets, which are also case studies. Before answering any questions, be sure to always read the directions. Fill in the blank type questions will be used for calculations including medications, flow rate, infusion time, and client input-output. When answering a fill in the blank question, make sure to only use numbers. Do not list the units such as milliliters, because your question may be counted as incorrect. Always read the questions carefully because some questions may require you to convert something. For example, converting ounces to milliliters. Lastly, only round at the end of a problem. Make sure you use the correct number of decimal places. Multiple response questions are questions that will have more than one correct answer. NCLEX requires you to be able to select all responses to receive full credit. No credit is given when the question is answered partially. Select all that apply questions are used for various nursing content such as nursing interventions, medications, and treatment responses. When answering select all that apply questions, you need to be able to break the question down by reading the data carefully and determine the subject of the question, then identify any strategic words. Next, determine if the question contains a positive or a negative event query. Therefore, knowing the fundamentals, normal versus abnormal, and then building what you know about the particular subject will effectively help when determining which answers are correct or incorrect. Nursing knowledge is a building process that starts basic and goes into depth, so try to get a mental image when building the knowledge so you can determine right from wrong and what is normal from abnormal. Prioritized questions on the NCLEX require you to be able to drag and drop the answers in order of what is most important to least important. These questions consist of nursing intervention skills and procedures that have to be listed correctly in the order that they occur. When answering these questions, analyze the data and then determine what would you do first, second, and so forth. Use the ABCs to help prioritize based on Maslow's hierarchy: airway, breathing, and circulation. Remember that blood can't circulate when someone isn't breathing, so airway always comes first. Using the nursing process and nursing procedure skills helps determine what the priority is and what steps are taken in an orderly response. Example: hand hygiene comes before client contact. Another example is document after completing a task or care. Figure and illustration questions give you a visual to look at while answering the question. You will need to determine what the question is asking, look for strategic words, and find important things in the illustration. Use nursing knowledge and clinical experience to determine the answer. Chart exhibit questions may require you to analyze data concerning a client's medical records and answer questions about that data. An exhibit that this type of question might provide you with is a primary health care provider's prescription from a client's lab results. Make sure you always read everything in the data because every piece of information is crucial. When answering these type of questions, make sure to always reread the data, identify strategic words, and make connections between the subject and the question provided. Graphic item option questions are questions that give you written questions by the answer choices, but the answer choices will be provided as pictures. Graphic item options questions are mostly in multiple choice format. These questions may require you to determine if the assessment is normal or abnormal. Audio and video questions are mostly multiple choice. You can replay audio and video questions as many times as you like. Audio questions require you to listen to sounds such as breathing, heart, and bowel sounds. Video questions ask about nursing procedures, so pay close attention to the content in the videos. Testlet questions are also known as case studies. These type of questions will always have a scenario that you must read. All information in the scenario is very crucial, so make sure that you read the entire scenario. Don't just skim through it. Also, make sure you understand what you read in the case study. Case studies may incorporate the other alternative question formats that I previously mentioned, so be sure to be prepared to answer the question how the directions instructed you to do so.